If you are working with a clinician who is trained in critical thinking and the art of the physical exam, then they need to understand directional preference. Identification of a directional preference is vital when it comes to managing your condition, and I'm going to teach you how to do it. So what is a direction of preference? Let's start with the joint. Every joint in the body is surrounded by tissue, which we call a joint capsule. Now, if that joint tissue and the joint itself becomes strained or irritated, you can present with pain, stiffness, or weakness. Now, that pain may be local to the joint or it may move away from the joint. This is where directional preference becomes very important. A directional preference is a situation in which one movement of the joint in one direction improves the pain, stiffness, and weakness. And conversely, movement in the opposite direction may irritate you and cause that pain, stiffness, and weakness to actually worsen. As the name implies, it's your joint's preferred direction to move in order to restore balance and heal properly. So how do I know if my joint has a directional preference, and if so, which direction should I move in? The key is to follow the clues that the body is giving you. So let's take neck pain, for example. Let's just say that I'm having more pain when I'm sitting down because I'm either hanging my head or protruding forward like this. The exact opposite of that would be retraction. So I can do this mobility drill all the way, making sure that I get to end range, even if it's a little bit painful, like so. If this movement makes my symptoms decrease or my mobility starts to improve, then you know you're on the right track. I recommend doing 10 to 15 reps 5 times a day, all the way back. I would do this over a 3-day period and take an honest look at whether or not your signs and symptoms of neck pain are getting better, same, or worse. If they're getting better, you found a directional preference. If they're the same, you may need to explore a little bit deeper. And if they're getting worse, clearly that's not the direction you should be moving in. When exploring for a directional preference, we have to respect the pain rules. There are 4 main pain rules. Now, you saw my example with neck retraction, like so. While I'm doing that movement, I have to take note of a few things. So number 1, the pain must be temporary. As I go through, it may hurt a little bit, but it should quickly subside. Number 2, as I do more reps, the pain should decrease or stay the same. So you should get better or stay the same as you do more repetitions. Number 3, you may experience centralization or localization. That basically means that the pain goes from widespread back to small and more local. It can go from down your arm back to the center of the spine. And then finally, rule number 4 is that after you're done, your movement should actually improve. You should not feel more stiff after you do your repetitions. How do I know if I found my directional preference? Well, there's one key thing. It's lasting improvement in the signs and symptoms that you're experiencing. So for example, if you're doing neck retraction and after 1 to 2 days, you notice that there's a 40, 50, or 60% decrease in symptoms and you're just moving better, then the body is cluing you in that you found a directional preference and you should continue. As long as you keep getting better, keep going. If your body hits a plateau, you can still keep going as long as you're moving towards that 100% recovery. It may take longer than 3 to 4 days, so be patient. Here are a few things to consider. Every joint in your body behaves a little bit different and responds to different types of movements. If the body is cluing you in onto what it wants, go with it. It's likely leading you to the right answer. I specialize in helping people find the source of their pain and problem, whether it's a muscle, a tendon, a nerve, a stiff joint, or a combination of them. Regardless of what the problem is, you need a movement exam. It is only with a thorough movement exam that we can determine whether or not your problem is coming from soft tissue, nerve, joint, or the combination. Make sure that you ask me or your practitioner about directional preference. You may be surprised that if you're moving the joint in the correct direction, how fast your symptoms can resolve.